Hello again, everyone. Dumelang. Welcome to another edition of Sports Health Talk, where we answer all your sports medical questions. Go to our Facebook page, please, and like the page. Don't forget to go to our YouTube channel and subscribe. And in case you missed the last editions of this show, go there and give yourself some time, sit, relax, and watch the previous episodes of Sports Health Corner. My name is Matlhomola Morake, and as I said, I'll be your host. Again, I'm not alone. I've got my twin brother here, Dr. Thulani Ngwenya. Dr. Thulani, welcome back.
Thank you, Shok.
Good to see you.
Good to see you too. It's always a pleasure, attending these shows and sharing some information.
Thanks, Doc. Thanks. Today we're talking about concussion. Some may call it a head injury. The last two shows, you remember that we spoke about pre-sport medical screening, and the previous one we spoke about it was the introduction basically to this series that will be running of sports injuries. But to get straight to the point, what is a head injury? What is concussion? What is the difference?
Okay, yeah. Thank you very much, Sloks. It's important again that we clarify that. A head injury is a blow to the head. That's a head injury. It could be from an accident, it could be from just someone hitting you, it's any blow to the head is a head injury. Now, there's a difference. A concussion is another type of a head injury. So there's different types of head injuries. You can have a head injury that gives you a structural damage. Maybe say your brain is now swollen, or there's fluid in the brain because of a head injury. But with concussion, it's a type of a head injury. But now with concussion, what then happens is that, just want to make an example. You are moving towards a particular direction, moving high momentum, high speed towards a particular direction. And then there's an opposite force that hits your head towards a different direction. Then what then happens? There's an abrupt shaking of the head. Remember, the head, inside the head, there's a skull. This bony part is a skull. It's hard. And inside that head, there's fluid called the cerebrospinal fluid.
Yes.
And then on the fluid, there's a brain floating on that fluid. Now, when momentum is pushing that way, an external force hits you towards a different direction, your brain, which is inside with fluid, will continue going to the direction that we're going to, but your head will then go a different direction because of the blow. Now with the abrupt shaking, it causes the electrical disturbances in the brain, and
wow,
that is concussion.
Wow.
Now most of the time, with head injuries that are not severe, or a force that is not severe, you will not have a structural damage. So for instance, if you do a CT scan, it will show as if everything is normal, but you still have symptoms of, then one would say, no, but this one is fine, it's just minor symptoms. Then they clear you and then you go to play. But the problem with that is that if you do not manage concussion correctly, then you might have problems. So that's the difference between concussion and head injury. Concussion is a type of head injury, but it is more of the disturbance that happens with the abrupt shaking of the head.
So then, Doc, how do you evaluate this? Because on a soccer field or football field, players go up for a header, clash of heads, or even a goalkeeper is involved with a fist.
Yes.
So what happens there? As you're sitting on the bench as a medical personnel, what do you see? What comes into mind?
So with head injuries, it doesn't matter what code it is. It could be you are in cricket and you are hit by the cricket ball after the batsman hit going for maybe a 6 or a 4, and it hits your skull and then you go down. That we treat it as a head injury, or rather concussion, until proven otherwise. So you run in already, your first differential is concussion. For instance, if there's a blow on your head by another player in football, another player hitting you with their knee on the head, and then you go down, it's a concussion until proven otherwise. Now, what normally happens is that most of the time, those that don't lose consciousness, they want to stand up and start walking, and then you'll see they're losing balance, they are not walking properly. Then that confirms that this is most likely a concussion. But what happens is that when you see a head injury, you go and you approach, you are treating, you are looking for concussion, ruling out concussion. So what happens is that you go straight. Is one of the head injuries is also categorized as a medical emergency. So you need to rush in without, even if the referees haven't called you, you rush in because it's a medical emergency, just like sudden cardiac arrest. So you rush in, and as you rush in, your approach, you are treating a head injury before you actually look for concussion. Now with head injuries, it's not because the head is controlled by the neck. Then you need to treat head injury together with the neck. That is why when you go in for a player that is lying down, you go to the head, you try and stabilize the head first and the neck, because you don't want, if then there's a neck fracture, you don't want to make it worse. Keep on moving the neck. So you stabilize the neck, and then you start interacting with the player.
So in other words, the two go together?
Yes, because remember, the neck controls the head. If there's a blow here, the neck also goes. So if there's a blow here, the neck also goes, because remember, the neck goes with this heart structure towards that particular direction. So if there's motion towards this direction, going front, but there's an opposite force, it will take the structures like the neck, the skull, but the brain will still continue going that way. So it is very, very important that you treat the neck and the head together. So when you go in, as you go in there, you go straight and stabilize. That's the first thing that you need to do. Stabilize, then start talking to your patient.
How serious can a concussion be?
Yeah, well, before we go there, maybe let's also touch on what do you have to look for.
Yes, please.
When you are there now, you are suspecting a concussion. Firstly, you need to determine whether the person is conscious or not. The second thing, then you start asking if they are aware who they are, where they are, and what time more or less is it.
In fact, I've often seen doctors on the field doing this to players, saying how many fingers and what have you.
Yes.
What is all that?
Because remember, when you are concussed, a lot of things happen. You develop nausea, you develop headache, even your eyes become disturbed. Because remember, the brain is the engine of everything. So a lot of things are controlled in the brain. So when we are asking whether you can see, we want to see if you can see properly, because your eyesight might be affected. So your balance might be affected. That is all those things that we ask for. Even your memory might be affected. So then it also now takes us. That's what you do on the field. If they can remember who they are, where they are, and they remember even previously what happened, which team they were playing against, what was the score, then you are somehow certain, if they don't have symptoms on that time when you're asking them, if they don't have headache, they don't feel dizzy, and they don't have photophobia, like sensitivity to light or noise, then you should be then somehow.
Now, does that assessment, does it happen where the injury took place, or you move the player?
Unfortunately, in football, we do it there, but the right way of doing it is to remove that person. That is why in rugby, they remove and then they put a sub that will be in for that time. When you're doing the assessment, you're given a particular time to do a proper head assessment, because a lot can go wrong if you do not do it properly. The concussion can develop into something really severe. Balance problems, learning disabilities, memory issues. There's a lot that can go wrong. So it is very important that you make a proper assessment.
And then what happens afterwards, once you've assessed what the situation is?
Once you have assessed and you are certain that it is not, most likely it's not concussion. Then they need, in rugby, then they go back, and then the person that was put in is removed. In football, there's such discussion now to do a proper assessment, because now we're seeing quite a lot of concussion in football. Even here in local football in South Africa, we're seeing quite a lot of concussion, but the approach towards concussion, it still needs more education and deliberations within colleagues, so that our approach to concussion is the right approach. Because I've also seen quite a lot of our colleagues in sports that are not sports physicians, I must emphasize, that are not sports physicians, but they are taking care of teams. With a head injury, what they'll do, they'll take a player for CT scan. They'll leave a player to take a player for CT scan. And if the CT scan is fine, then it's all good. There's no structural problem. But with concussion, it's different. You may not see a structural problem. The scan might come back. Most of the time, the scan will come back normal. And that does not rule out concussion. That is why you need to do a SCAT assessment, which is a sport concussion assessment. So it is very, very important that you do a SCAT assessment there when it has happened, and then you pick up all the symptoms, so that when you have picked up that this person is concussed, because they need to meet a certain criteria, then you need to graduate them back to now doing activities. It starts with graduating, and it takes sometimes, it takes some 3, 4, 5 to 6 weeks. So there's a duration of graduating and coming back to college.
And during that period, they're not playing, they're not active?
They're not doing anything, because you need to start slowly by doing things slowly. So for instance, when you are concussed, we tell you to be away from activity, even reading, even TV, avoid such, because those are your stimulators. For instance, we know that when you're concussed, you've got photophobia. So when you're busy watching TV, then that will then make your photophobia symptom not to improve, because you're watching something that is bright and going into your eyes. So we say,
very interesting.
Keep a dark area, don't be active, try and rest as possible. And then from there, we then want to graduate you to the next level. The next level now, you'll be starting minor activities like going into a swimming pool and doing exercises in the swimming pool. If you graduate from there, you do again minor activities, light jogging on the field of play, and then from there you do your sport specific. If you are a footballer, you do activities that are football specific, and then from there then you graduate up until you join the whole team. So there is a process. You can't be concussed today and you are confirmed that you are concussed today, and then next week then you are playing. That then makes you to have problems of having complications of concussion.
So Doc, tell me, if not treated properly, what are the risks?
The risks are huge. It's complications actually, because the brain, like I said, is the engine of the body. So most of the things are controlled in the brain. For instance, your hearing is controlled in the brain. If something really goes wrong in the brain with concussion, then you might have hearing problems. Your brain controls your vision. If something goes wrong in the brain, you might have visual problems. Your speech comes from the brain. So if something that goes wrong in the brain, you might even have speech problems. Your balance, comes from the brain. So there's quite a lot that can complicate with concussion and head injury, with the head injury overall. And with concussion specifically, a lot can go wrong according to the symptoms that you have. Again, it will also depend on the impact or the force that was applied on you when you had concussion, because when the force is big, sometimes you might have structural problem where you've got the actual brain damage or getting injured, contusions, or either swelling up or tearing, So it depends on the force that is applied on the brain.
And has there ever been a player that is, or an athlete that has stopped taking part in sport because of concussion?
Yes, of course. We've seen several elite athletes that had to stop playing because of concussion. Concussion on its own, if managed properly, you can actually continue playing. And we've seen quite a number of players that have suffered concussion and they are still playing. But the challenge is that if not managed properly, it complicates later. There's some rugby players, example, that when they end their career, they develop a severe disease because of the concussions that they sustained during their playing days.
So in other words, what you're saying is that you could be concussed during your career and only suffer later.
No.
For instance, in boxing,
yes,
you get hit a lot on the head, and perhaps you knocked out,
yeah,
and then you wake up, you're back on the ring,
yes,
months later, but it can affect you later.
Well,
it may, or
it may. And again, the recurrence of concussion. Remember, if you've got a structural, if you've got concussion now, remember it affects some of your systems in the brain. And if you have another concussion, it will go back to that injury of that particular part of your brain. And you get injured again, it will end up complicating because you've been having the same over and over and over again. It's just like an overuse injury, just to make an example. Today, if you've got, you are prone to having ankle sprains, you keep on spraining every now and then. The next thing, you're going to tear because you keep on, this injury keeps on recurring, and then the next thing is going to tear. Tearing is the end point. That's when now it needs repairs and it needs you to go for surgery. That happens now over time. And even with concussion, most complications happen after a long period, and mostly it suffices when you're at the end of your career. But you may still complicate during your playing time.
Doc, it must be difficult for people like you in the medical profession to have to actually rule out a player, captain of a team or a star player in the team, to say, listen, you're concussed, coach, this person cannot continue anymore. It must be very difficult.
That dynamic is actually very difficult because I'll just make a few examples. Fortunately with me, I've had a situation where a player in the 2014 AFCON was concussed, a defender was concussed, and I made the call and the coach listened. Now, there was a World Cup in Brazil between Uruguay and I think it was against Brazil, if I'm not mistaken, where a player was hit with a knee and they suffered the concussion. You could see when they are waking up that they are dizzy, and the doctor made a call to say that player cannot go back to the field. But the player was saying, no, I want to go back, and insisting that they want to go back. And the coach said, no, this player must go back. Now, that then became a gray area. Now, in medicine, we are taught that with a person that has a head injury, they do not have capacity to make a decision for themselves. So it's the doctor that needs to make a decision for them. Because remember, even with injuries, we only advise to say this person is not fit. We give our medical opinion, but we can't determine to say, no, they're going to play or not. That is a decision of the player and the decision of the coach. We only advise. But with concussion, that's where we're given power to actually make a decision for that person because they are not capacitated to make a decision. So even the coach cannot come and impose because it's a medical professional that is making that decision.
So in other words, the last word is yours when it comes to concussion.
Concussion, yes. When it comes to concussion, the last word is the doctors, because we're saving up people's lives here. Our sole responsibility is to save people's lives. The other things, our primary responsibility is to save people's lives. The other things are secondary to them.
And Doc, have you been in a situation where you had to make a call, whether right or wrong, and yes, you found that, I must admit, I got it wrong?
Yeah. I want to be honest, with me so far, especially with working with professional athletes, I haven't had a situation where I have made a wrong call when it comes to concussion. Why? Because that is why it's important for people who are in sports, elite sports, to go through the course of sports medicine, not just any other medical practitioner being there, because we are also taught that for a head injury, the first thing on top of your diagnosis is a concussion until proven otherwise. So for me then, I start there, just clearing, making sure that I've cleared. Sometimes you might miss symptoms, but for me, I haven't had the situation of missing out symptoms of a concussion.
Doc, in closing, concussion is a very tricky injury to get, to obtain, so to speak. Can you prevent it?
We're talking preventative medicine. Unfortunately, with contact sport, it's quite difficult to prevent a concussion because we're talking contact. Imagine rugby, they do scrums, and the tackles, they are high velocity tackles. That
boxing, those punches.
They punch you like
in football. They head us,
and you can even head a post, for instance, or your head can go down to the floor if you miss, or maybe when you're jumping high, someone goes under you and then you go down to the floor. So you can't really prevent it, especially in contact sport.
Oh well, how time flies. Doc, it's been great, it's been awesome. Thanks once again for joining us in this edition. See you in the next edition when we again deal with another topic that has to deal with sports injuries. Please go to our Facebook page, the Sports Medical Corner, like the page and go to our YouTube channel and subscribe there. And again, don't forget to tell your friends. If you have questions or comments about what you've heard or what you've seen, please don't hesitate. Drop us a text, drop us a line, and we will gladly assist in answering all your questions. And if you want to pay Dr. Thulani Ngwenya a visit, go to our Facebook page. All his details are there. You can make a booking and make sure that you are treated in these great facilities that we have here. Remember now, we are the Sports Health Corner. We answer all your medical questions. Don't forget, this is my show, this is your show, this is our show. Stay safe, stay injury free. Till next time, I'm Matlhomola Morake and I'm out.